All right, good afternoon, everyone, and thank you for attending this session of Grand Rounds. I'd like to welcome our presenter for this afternoon, Dr. Alan Junkins, who will be presenting on what do we get from our pets. At this time, I'm going to stop sharing my screen and turn the presentation over to Dr. Junkins.
Okay, hey everybody. Let me get this up and going here if I can. All right. I think we're good. Yeah, today we're going to talk
Dr.
about...
Junkins, you might... So sorry to interrupt you. I think you're in presenter mode on our screen. Sorry about that.
How am I in presenter mode? Okay, let me try this again. How's that?
There we go. Looks great.
Oh, you see, it's all backwards on my computer now, but that's okay. I'll have to look at the wrong slide. Anyway, yeah. Okay, all the great things that we get from their pets and some of the not so great things that we get from our pets. So we're going to talk about some infectious diseases that come from animals. And here's just some ways that they get to us. We'll go through each one of these one by one. And, you know, when I was looking at this, I found this paper, which is kind of old now. It's from 2011, but it's just really impressive. All the bites, wounds that come from various animals. I thought this was very impressive. And I especially like these two down here, you know, swans. A Pseudomonas aeruginosa infection in a 39-year-old woman who was vigorously pecked on a finger. You know, that one just kind of hit me because we always think of, you know, swans as being so regal and serene, and apparently they can be vigorous peckers. So you got to watch out for the swans next time you're around there. And I also like this one, the sharks. Buck et al. Studied the oral aerobic flora of a male great white shark. You know, doesn't that just sound like the you know, the job you give to the new graduate student, kind of a hazing thing? You know, take these swabs and go swab that mouth of that great white shark. But I took my cues from this paper. This paper is kind of like a, you know, a catalog of all these different animals, and we're going to kind of go through that too, kind of do a catalog of infections that come from pet bite wounds, and we'll start with dogs and cats. These are kind of the ones that we're going to cover. We're really going to hit the ones that are more associated with dogs and cats, the bugs that we think of when we think of dog and cat bite wounds. But, you know, I do want to point out that dogs and cats, their mouth flora also contains a lot of the same staph and same strep and same anaerobes that we have. And of course, our skin has some of those bugs as well. So even though there are certain organisms that we think of as the cause of bite wounds, don't ignore the fact that a Staph aureus or a Strep pyogenes or you know, a Prevotella could be in there doing the same thing. That you'll find those as well. But let's talk about the biggies. And the biggie with dog and cat bite wounds is going to be Pasteurella. That's the one that we really think of most of the time. Normal flora of the mouth and upper respiratory tract of a whole bunch of different animals. Almost all cats have Pasteurella multocida. About half of dogs will have that same strain, but actually more dogs will have Pasteurella canis. And there are these other species that we get. It's not infrequent that we get Pasteurella dagmatis from bite wounds as well. So there are some other ones as well. In fact, just to show you the range here, I found this paper. Now, this paper is from 1985, so it's a long time ago. Pasteurella multocida from a tiger bite. So when we say cats, we're not just talking about fluffy. We're talking about cats, all cats. In fact, in this paper back in 1995, they knew not just cats, but animals involved have been 2 rats, 2 possums, 2 lions, 1 horse, 1 rabbit, 1 boar, 1 panther, and 1 tiger. So there's a lot of animals out there that have Pasteurella. Next time you get bit by a boar, we may be considering a Pasteurella. These are usually going to be skin infections. They can be rather gnarly, kind of inflamed and red and painful. The bug often will go septicemic from there. and settle down in other places. So you will see Pasteurella osteomyelitis every now and then following a bite. But you also want to watch out for Pasteurella as far as respiratory tract infections that actually come from direct contact. So if you are, snogging with your dog and you're too up and close personal, the dog is licking you all over the face and everything, you can breathe that in and actually go straight to a pneumonia, which can be quite serious. So don't get too friendly with your dogs. This is old data too. This is from us from 2015. These are all the Pasteurella isolates that we had in 2015. There were 29 of them. And all these that are listed on the left side were all forms of bites or scratches from an animal. And I thought the distribution was interesting. Just look at, cats go for the hands and the fingers, like a cat just wants you to leave it alone. A dog is trying to kill you, it goes for the face, it's not messing around. But those are 25 out of the 29 that were all various forms of bite wounds or scratch wounds. We had one from a blood, which was a case of pneumonia. Okay, we had one from a meningitis case. So there are some other presentations of Pasteurella, but obviously the great majority are going to be dogs and cat scratches, dogs and wounds, bites. So here's some examples of it. The inflammation, the painful looking, the red streaks up the arm. That's kind of common. And this one, it's kind of hard to see the original scratches there, but just simple scratches leading to cellulitis and septic shock. So it can be a tough infection. For us in the lab, this has always been kind of a difficult bug to identify. It grows okay. Unlike most gram-negative rods, it will not grow on this McConkey plate over there. If you gram stain it, short gram-negative rods, nothing too stand out about the way the gram stain looks. It was always kind of difficult to do because it's biochemically not very active. And so we would try our biochemical identifications and not have any luck. And after a few days, we'll say, well, let's see what's going on with this patient. And we'd say, oh, it's a cat bite. Oh, well, okay. It's going to be Pasteurella then. So the epidemiology was a big hint. Now we use MALDI. And as soon as we have it on a plate, we put it on the MALDI, and the MALDI tells us that it's Pasteurella. So it's gotten much easier for us. Another thing where MALDI has made a big difference is with various species of Neisseria. When we think Neisseria, you're going to think Neisseria meningitidis and Neisseria gonorrhea. There are a lot of species of Neisseria. I've listed 4 over here that are predominantly associated with animal bites. In fact, I like some of these names. Zodegmatis is zoo, animal bite, animal loris, animal mouth. I mean, great. Some people really figured out how to name these things correctly. We were never able to identify these before. Never had any way. Our biochemical methods would not look for these bugs at all. But then along came MALDI, and now these are fairly easy. They are gram-negative rods. They are not gram-negative cocci, like we think of with gonorrhea or meningitis. So it's not, it's something that's kind of a surprise when you have a gram-negative rod. It's growing very nicely on your blood plate, and then MALDI tell you that it's Neisseria. We had to kind of get used to that, but now we see these several times a year. Don't do any susceptibility testing on them, but it's not really necessary. Empiric therapy will take care of it. I like this article too. Not to belittle tiger bites or anything here, but this is another paper from 2002, mixed infection with Neisseria weaveri and a Pasteurella multocida in a tiger bite. It made me kind of wonder how often are kids getting bitten by tigers. But I love this line down here at the bottom: an unfortunate encounter with an adult white Siberian tiger. Sounds like a little bit of an understatement, your parent, you get called from the zoo, your kid had an unfortunate encounter with a tiger. But the Neisserias are one that we actually see pretty frequently now that we never would have seen really before. Never able to identify those before. Here's another one that's interesting, Capnocytophaga. There are actually now about 12 different species of Capnocytophaga. Some of them are normal flora in the human mouth. I know that I have a nice crop of Capnocytophaga in my own mouth. And others are normal flora in the dogs and cats. Again, good names to these. The two biggies are going to be Canomorsis, which literally means dog bite in Latin, and Cynodegmi, which literally means dog bite in Greek. There's some differences in the way these look. The human strains tend to look like this: long, skinny, pointed ends, these gram-negative rods. That's a fusiform look. And we like it when we see that because we kind of know exactly what that is right from the very start. The dog and animal isolates don't tend to be that long. They're still fairly long, fairly skinny, but they're not quite like the human strains. And then on the plates, it's the same kind of thing. The human strains tend to give us this very flat, spready colony, very, very typical. The animal strains are a little harder to tell. They're kind of much smaller. They're more typical colonies with a little bit of a yellowish tinge to them. So change a little bit more difficult there. Typical bite wounds with these, but you have to be really worried about sepsis, especially in patients who have some form of immunocompromise. This bug can invade into the bloodstream and really do some damage. Mortality, this of 30% or so. This is just one example here of a patient who died from Capnocytophaga canomorsis septicemia. Most of the time that we get Capnocytophaga, it's not from the bite wound itself. It's going to be from the blood culture. We have already had a couple of these just in the last month, or not a month, about a year or so. So we do see it fairly frequently. And both of those have been from blood cultures. Wanted to bring this one up. This is not one we normally think of with dog bites, but it's Blastocystis dermatitidis. I wanted to do it because Blastomyces is my favorite mold. Everybody should have a favorite mold. My favorite is Blastomyces dermatitidis. And the very first case of Blastomyces that I ever saw was actually a dog bite wound that looked just like this one right here. It was a teenage boy who had been bitten, just a little nip on the back of his calf 9 months earlier. And then after 9 months, he presented with a wound that looked like this, and it was blastomycosis. Normally think blastomycosis as being a disease you get from breathing in mold spores, starting a pulmonary infection, and then some spread from there to bones, to various organs from there. We don't really expect to see it in cutaneous, primary cutaneous infections such as this, but it is a common cause of, not a common cause, but it is a cause of dog bite wound infections. It's a very common cause of disease in dogs. This is what we would see in a gram stain or a tissue stain of it, the yeast form. This is what we're actually going to grow in the lab, this mold stage down here. So histology, fungal culture, if you see something like that, we want to make sure there's a fungal culture done. It's not going to go on a regular routine bacterial culture. There are urine and serum antigen tests that can be done, and there's immunodiffusion to look for antibodies. So not one of the ones that springs to the top of our head when we see when we think of a dog bite. But if it's a presentation like this, a very gnarly and kind of chronic infection, then Blastomyces should be in the differential. All right, let's talk cats. The classic disease here, because this is the one that we actually call cat scratch disease. So we think of this as being the disease from cat scratches. It's cat scratches, it's cat bites, it can just be saliva. Usually going to be transmitted from kittens. Adult cats don't transmit this very often. The symptoms of the bite or the scratch itself are not incredibly too impressive. You'll get these papules that will develop at the site. Takes them a week or so to develop, and then another 2 or 3 weeks before they're going to go away. It's not a huge, impressive wound like we've seen with these other bites. There will typically be swollen lymph nodes in the area, just like this, that may take a couple months to go away. So you'll have that. Beyond that, some systemic symptoms that can come along with it. And then the big concern is going to be these complications. Endocarditis, for example. It's one of the predominant causes of culture negative endocarditis. Certainly, if a patient has endocarditis and we're not growing anything in the blood culture, then kind of think about the possibility of cat scratch disease. And all of these other ones here that can go along with it. So it's a disease, it's a fairly common disease. We certainly see enough of them around here. Diagnosis is not really that difficult. These days, PCR is the way to do it. Best thing to do would be to take some tissue from that lymph node if you can have it. Blood doesn't work very well. Spinal fluid can work well if you've got some invasion into the central nervous system. There is serology. The problem with serology is that you really want to have both the acute and convalescent. If you do a convalescent serum, that means you're not going to get a result for a couple of weeks, 2 or 3 weeks at least. So you can't just wait for the diagnosis there in order to start treatment. You have to kind of go straight forward with it. And I put this in here. Yes, culture is possible. Please don't ask us to culture for Bartonella. We're not going to culture for Bartonella. It takes special media. It takes a long, long, long time. So that's not a good way to do it. If cat scratch disease is suspected, really the way to go is going to be do PCR, like a lot of things these days. All right, let's get away from dogs and cats. There are some other pets as well. There's a lot of people out there who have rodents as a pet. This cute little guy here, you know, it can be rats, it can be mice, it can be some other things, gerbils or something like that could also spread this. This is rat bite fever, which is another good name, kind of like cat scratch fever. Rat bite fever tells you exactly where it's going to come from. It can be any of these things right now. A rodent bite, just contact with secretions from the organism, from the animal, contaminated surfaces, or if you happen to hopefully mistakenly ingest rat feces. Kind of systemic symptoms: fever, vomiting, headache, muscle pain. A lot will have joint pain, and most of them are going to have some sort of a rash. All of these symptoms can show up after the bite. You may see the bite. The bite may not mean a whole lot. It may not inflame. It may not do much of anything. And after that heals over, then the fever can come on later. It is a serious disease, 10% mortality. So it's not something to blow off. There are 2 bugs that cause it. This Spirilla minus is a spirochete that is really not going to be found in the United States. It's going to be mostly in Asia. So we really don't see that. It's not culturable. It will not grow in culture at all. The one that we're going to get here in the United States is Streptobacillus maniliformis. It's kind of a finicky, slow-growing bug. We can isolate it. We have had a couple of isolates in recent years. It's kind of difficult to do, and the reason is the specimen that you want is blood here. That's where you're going to get it from. But Streptobacillus is inhibited by SPS, sodium polyanethyl sulfonate, which is the anticoagulant that we use in blood culture bottles. So a lot of times it just won't grow in the blood culture bottle. There are some things that we can do. If we know that we're suspecting rat bite fever, then there's some things we can do to try to encourage it to grow. So we've isolated a couple of times. Who knows how many times we've actually missed it. I will do have some stats here about if you're wondering how often rats have this. There was a study that was done here. I've got it off to the side here. Somewhere between 10 to 100% of domesticated rats are colonized with Streptobacillus. That's a big range, somewhere between 10 and 100%. You probably all could have guessed that. Wild rats more commonly, 50 to 100% of the time. So figure that in all likelihood, that rat, whether it's wild or domesticated, probably is colonized with Streptobacillus maniliformis. This is what it looks like. It's a cool gram-negative rod, long, skinny, kind of weird shapes to it, weird arrangements. So it is an unusual looking bug. Grows okay once we can get it on a plate. The idea is we have to get it growing in the blood culture first, and then get it to the plate. So that's rat bite fever. Those are all the bites and scratches we're going to talk about. Let's talk about pet feces, pet urine. And there's two that I want to hit here. The big one, Toxoplasma. This is a big life cycle. This is a parasite now. This is a protozoan parasite. So it's going to have a rather more complicated life cycle than your bacteria do. Cats, all kinds of cats, are the only definitive hosts. Those are the only animals that get the intestinal form. So they will, if they have the protozoa in their gut, will start producing these fecal oocysts that have the infective organism in it. After they're infected, they're going to shed those for 1 to 3 weeks. The natural cycle of things is that they poop out in the environment, and along comes a mouse or some sort of rodent or a bird that is going to eat something contaminated with that cat poop. All right. And then they will become an intermediate host. They will have these tissue cysts in their muscle tissues. And then what does a cat do? A cat catches a mouse, catches a bird, and eats it. And then it spreads on that way. So this, from cat to rodent to bird to cat to rodent to bird, that's the natural cycle of things. The problem is farm animals, cows, pigs, sheep, can also eat something that's contaminated with cat poop. And they get the tissue cyst. And then if we eat that animal without cooking it well enough, we can become the intermediate host and get the tissue cyst. Or we can go the other way. If we come in contact with these infective oocysts, then if we eat those, then we can get infected. It does take 1 to 5 days. After the cat poops out these fecal oocysts, it's going to take 1 to 5 days before they're infective. So you do need to have a little bit of time lapse from the cat coming out to you eating it. Healthy people generally have no problem. A whole bunch of us have been infected with toxoplasma sometime in our life, and it really doesn't cause much of a problem. Some people will have a kind of a flu-like illness that can actually go on for quite some time, but then it goes away. The concern that we have is with pregnant women. That's the main issue, because this is what happens. This is called the tachyzoite stage. This is the stage that the bug is originally in when it comes into your body. This spreads around, it's rapidly growing. After about a couple of weeks, you will produce antibodies. You'll have an immune response, which is going to force the bug into this bradyzoite stage. This is the cyst that's in your muscle tissue. The concern is this stage, the tachyzoite stage, can cross the placenta and infect a developing fetus. This stage cannot. So if you are infected with toxo when you're pregnant, then the fetus can become infected. But if you were infected 2 months before you got pregnant, then you're not going to have a problem, because this stage cannot infect the fetus. Now, the other thing that we worry about is that occasionally you can reverse this. And if there's a stage of immunocompromise, or for some reason why that tissue cyst cannot be maintained, then it can revert back to the tachyzoite stage. So you can see situations where people who were infected early in their life later come down with some sort of immunocompromise that then reactivates the tachyzoite stage. So those are our concerns. The fetus can have all kinds of problems. It's a very complicated disease. It really is. There's all kinds of things that can go wrong with this. And immunocompromised people can also have the same situation. So it's a very complex disease. It's one you really don't want to, it's one that, like I said, a lot of us have already, but you don't want to have that stage when you're pregnant or immunocompromised. Here's just some ways to prevent it. Most of the time, you're not getting it from eating cat poop. Most of the time when people really get this, they're out gardening. My cat always would poop out in the flower bed, and you're out there gardening and you're handling cat poop without really realizing it. Or meat, an infected pig or pastured cow, if you're handling raw meat, you can get it that way. So there's all kinds of rules here about what you should do if you want to prevent getting toxoplasmosis. Especially important for pregnant women and immunocompromised people. Diagnosis, several things that can be done. Serology is usually the way to do it. You do want to be careful with this because there are false positive tests. We don't want to be in a situation where we tell a pregnant woman, oh, look, you've got fresh, new, active toxoplasma infection on the basis of a false positive result. So there needs to be confirmation of those results. We can see it in tissue, and there are PCRs that can be done on those specimens right there. That's toxic. Let me hit a few more. Leptospira is one that we really don't worry about too much. This is going to be spread by exposure to urine of wild animals. Lots of symptoms, including this conjunctival suffusion here, a rash that can go along, eventually can lead to kidney failure. So it can be a serious disease. Dogs are very susceptible to infection. But the data seems to show that even when your pet dog has leptospirosis, there's not a whole lot of a chance of it spreading to you. When humans get leptospirosis, it's almost always from wild animals. You go to a lake or something. There's been all kinds of infections of people swimming in a lake that various animals have peed in. So that's the way humans usually get it. And the way to prevent getting it from your pet is to make sure your dog is vaccinated against leptospira. This is a spirochete. That's what he's going to look like. We can actually grow this thing, but come on, if this medium is something we don't have, it's not a good way to do it. It takes a long time. So don't try that. Serology is the way to do it. PCR is available only at the CDC, but it takes some turnaround time there. While we're on dog poop and cat poop, let's talk about worms a little bit, because we're always thinking with our pets, that they get worms, they have to be treated for worms. So can they spread those worms onto you? First of all, hookworms and roundworms, like these guys, yes, it is possible. The dog is going to poop out the eggs, or the cat. Those have to go out in the environment. They have to mature in the soil for a week or 2 weeks or 4 weeks for roundworms. So fresh poop is not a problem. The problem is going to be poop that's been out in the soil for a certain amount of time. So there you're more worried about yards or play areas that are contaminated with aged feces. A worm that we see pretty frequently in humans is going to be Dipallidium caninum, the dog tapeworm. You actually get this from eating fleas. And so it's usually going to be small children that get this. The little toddlers, the ones who crawl on the floor following the dog, and any little black speck that you see on the carpet is going to pick up and go in their mouth. So that's kind of the way you get it. The dog will have it. Usually the dog has it in their intestinal tract. The flea will eat these eggs, and then the flea gets infected and the dog gets it from eating the flea. So humans are going to get it from eating the flea as well. It's a tapeworm. It sounds disgusting, it sounds gross, and it can be a pretty long tapeworm. But it's almost always completely asymptomatic, except for the fact that you will pass these proglottids. They're called pumpkin seeds. To me, they're not pumpkin seeds. They're like little sesame seeds. They're very cool when you see them. It kind of grosses you out to know that your kid's got a tapeworm, but it's not a serious issue. Lastly, just end up with some others. Let's point the blame at fish as well. If you think you're going to be safe by having fish, you do have to worry about contact with fish or contact with the fish's environment. And I'll mention a couple here. Aeromonas is one. It's a cool bug. It's a fast-growing, hardy gram-negative rod. Not a problem for us at all in the laboratory, and can be very serious. There have been reports of people who've gotten stuck by a fish hook, for example, and died within 8 hours from an overwhelming Aeromonas infection. But that is kind of what a skin infection is going to look like, really a very strongly acute infection. Easy to grow, easy for us to deal with. Mycobacterium marinum is commonly called fish tank granuloma. It's going to be a crusty, dry, more chronic infection. It takes a long time to come up, long time to go away. The fish tank granuloma, because it's often seen in people who have fish tanks and they're cleaning their fish tanks and they're dealing with their fish. We need an AFB culture for this. It is not going to grow on a regular routine culture. So again, like the Blastomyces, if you see those chronic infections, then we need to go for fungal or AFB. And let's talk ringworm, as long as we're on it. A lot of dermatophytes, species that cause ringworm, primarily live on animals. This is a lesion on a dog right here on the left. And this is a kid who's got a nice case of ringworm. Just contact, just hugging the dog, scratching the dog can spread it. Typically, we don't grow it. Typically, this is going to be a clinical diagnosis. A physician's going to look at that and say, you've got ringworm, and there'll be some topical treatment for it. But we can grow the bug. This is Microsporum canis, dogs. This is what it looks like under the microscope. So it's pretty easy for us to do it, but most of the time, this is going to be a clinical diagnosis and not something that the laboratory needs to get involved in. Okay, so after all that, is having a pet worth it? Of course it is. Come on, look at this face. You got to get the kid a puppy. The kid wants a puppy. So that's what I have got, a whole catalog of different problems you can get from your lovely pets. Any questions I can answer for you?
Hey, Alan, this is Sarah.
Hey.
So I know you mentioned that paper. In the life of an ID pharmacist, sometimes we get the question of somebody got bit by a whatever. Do you have any favorite resources that you can recommend as far as thinking through what somebody might be infected with, depending on what animal they've been exposed to?
You know, I would have said no until I found that paper a few weeks ago and said, you know, that's pretty exhaustive as of 2011.
Okay.
So that's probably a pretty good one to go with. Other than that, you know, I hate to say it, other than that, you know, you Google and see what you get, you know.
All right, cool. Thank you.
I don't know. I mean, we're kind of borderline here, you know, between clinical microbiology and veterinary microbiology. I'm sure that there are veterinary journals, veterinary societies that have a bigger range of that, but they're not typically interested in human bite wounds. But there's going to be some information there too. Okay, thank you guys very much.
Thanks, Dr. Junkins. Everybody join us next week, and we're going to have a presentation from our antimicrobial stewardship team.